Very often, after one in-service session, we're ready to start taking photos on patients. Sometimes it can take a little longer if we don't have a lot of photo experience. A little tip on the hourglass-shaped mouth mirror. The mirror can fog over. There's a number of ways you can deal with that. One way would be to run cool water over the mirror before you insert it in the mouth. That'll radically reduce fogging. And of course, if we had an extra set of hands, we can have that person blow air across the mirror as a way to eliminate the fogging of the mirror. But those 6 photos should take less than 3 minutes to take. Less than 3 minutes. Now, rather than displaying those on a monitor, which is the conventional way, normally we would just simply upload them to the server and display them on a monitor in the operatory. Rather than doing that, I want to turbocharge this process. Naren, what happens when we turbocharge something?
Yeah, we get significant results. We get a significant bump, right?
It radically improves the result.
Yeah. Yeah.
So I want to turbocharge it. And rather than putting it on a monitor, I want you to upload those to a tablet, a tablet. Now, I'm an Apple fanboy, so I'm going to recommend that you do Apple iPad Pro. That's do the big size, the 12.9-inch diagonal. That's a huge tablet. It's a huge tablet. But you want the screen real estate to be as big as possible. So invest in the iPad Pro. By the way, you don't need a lot of memory on it because all we're doing is showing the photos. We're not storing them on the photos. We're storing those on your server, but we don't store them on the tablet. So you don't need one with the big memory. 64 megabits of memory is fine. Megabytes of memory is fine. So now we upload them to a tablet. And now we do something very theatric when we show these to the patient. We make an excuse to leave the room. Naren, if you were the patient and I was a new patient coordinator, I would say, Naren, remember earlier in the appointment when we took these photos of your teeth? Well, I've uploaded those now to this tablet. And I hand you the tablet. Put it on your lap. And I say it works just like your smartphone. You might have a tablet that you're familiar with, but if you're not, it works just like your smartphone. Take your finger and flick it, and it'll move to the next photo. And if you want to zoom in, you can literally kind of pinch your fingers outward, and you can zoom into infinity. Now we do something theatric. We make an excuse to leave the room. Naren, doctor and I need to take a look at the digital radiographs that we took, the digital x-rays that we took. While we're doing that, would you do me a favor and look through these photos? Make a mental note of any questions you have. And when doctor and I come back in, we'll be happy to answer any questions you have. And we leave the patient alone for 2 minutes, 3 minutes max. That's all it takes. And now when you come back in the room, odds are highly likely that the patient's going to start firing questions at you. Doc, what's this? What's that? What's this? What's that? And that would demonstrate that they're seeing their teeth in a completely different way they've never seen before. And this is a gateway to increase case acceptance. Because when the patient sees the concern and getting it taken care of is their idea, you're about 90% of the way to positive case acceptance. When it's their idea and they want to do something about it, you're well on your way.
Yeah, just to kind of add some more strategies to, how to further build on this. I mean, there are keywords like crooked teeth or, veneers, all these things that people are looking for that kind of tells you that they're already thinking about these things. So when you show them those pictures, I think, they're much more likely to, want to accept treatment. Like you said, picture is worth 1,000 words.
Right. And the reason why this ties into the topic of this podcast, less insurance dependence, is increased case acceptance and doing more ideal treatment is a great strategy for any practice at any stage of resigning from PPO plans.
Yes. But
it's also when a patient says, I didn't realize my lower teeth are so crowded. And, a good response from the doctor would be, Naren, does that concern you? And what the patient is typically going to say, well, it does now that I've seen it. Yes, it concerns me. And then let's say you're a good candidate for adult orthodontics, the way to correct that crowding. Then we're going to share with you a great treatment plan. It could be veneers, it could be adult orthodontics, depending on what the case is. Now, neither of those is covered by insurance. But guess what? The patient is interested in having it done, and people will often accept things that they want before they accept things that they need. They'll often pay for things they want before they'll pay for things they need. So this is a great way to do more ideal dentistry. And regardless of where you are in your journey to drop plans, when patients are interested in their mouth, that's a positive thing in your practice. So this fits very directly to the topic of this podcast. And it's a great way to grow your practice. Now, I still want you to stay on task of dropping these PPO plans, but this is a great thing to do in a parallel track to enhance your practice for sure. And you can do this, you can implement this immediately in your practice. Photomed.net, PHOTO.med, PHOTOMED.net is a great resource for all things cameras for dental offices. They're in the state of Washington, but they serve dentists worldwide. And you don't need a fancy camera. You can use a simple dental point and shoot camera to take these photos. And I would encourage you to train all of your team members to take these photos. Every team, that way you have no excuse. If it's only one person that can take these photos and she's tied up, then that isn't going to be possible. So we want to make sure that in every case, every one of our team members could jump in and take these photos. And every one of your team members can develop competency around taking these photos. But this will literally revolutionize your practice, this step. So we thought it'd be a great episode, and I want to encourage you to take this to the action step. Until you apply this information, you're not going to have the desired result. I like to say that education without application is merely entertainment.